Thank you. I just want to thank the gentleman from California and all my colleagues who came to the floor in the aftermath of that hour from the GOP side, basically criticizing on the Republican side the health care reform, the Affordable Care Act, also known as Obamacare. Sometimes when I listen to what the Republicans say about Obamacare, I'm shocked because I don't think they understand how many people are out there who've already benefited from it and who are really looking forward to October 1st because they can sign up for the first time for health insurance. And let me tell you, in my own district, I've had so many inquiries from people who are uninsured or underinsured or who can't afford the health insurance they have now. And I just want to say, I agree with the gentleman from California that this was basically resolved last November. It couldn't have been clearer that the president, for whom Obamacare is known now, was out there in the presidential election saying that the Affordable Care Act was a great accomplishment on his part and he was going to continue with it. And then you had Mitt Romney on the other side saying that if he was elected that he was going to repeal it. And so my colleague from California is right. That was resolved in the election. So why is it that our colleagues on the Republican side are trying to hold the health care reform hostage and saying that if we don't repeal it or delay it or defund it or whatever, we've had so many votes on this, over 40 now, that they're going to shut the government down? One has nothing to do with the other. I just want to talk about those three groups of people who were most positively impacted by Obamacare beginning October 1st. First of all, we know we have about 40 million Americans who are uninsured. Many of them are from New Jersey. They don't have health insurance options right now. This is going to be the first time, October 1st, that they actually have a rational, legitimate option to get health insurance, and they are waiting for October 1st to come around. Secondly, we have just as many people, maybe 80 million people, who may have health insurance, but it's very skeletal, doesn't provide much in the way of benefits, and they have to pay a lot of money out of pocket if they get sick or they have to go to the hospital or whatever. Those people also will benefit because every health insurance policy that's offered under the health exchange that the gentleman from California talked about will be a good benefit package, at least as good as what we know now as, say, Blue Cross Blue Shield. And then you have the third group of people who may have health insurance, but they're spending so much of it in order to make sure that they have health insurance. They're spending so much money that they can't pay for their rent or they can't pay for their mortgage or they can't put food on the table. All these people are going to benefit come October 1st when they can sign up for a good package and an affordable package. And one of the main reasons it's affordable is because the federal government is helping pay the premium, helping subsidize the premium with tax credits, but not tax credits that you have to pay up front and then you get a refund when you file next April 15th, but a tax credit like a subsidy that goes directly to pay for the premium. And we're already hearing, I've said this to my colleagues in New Jersey now, they're saying that the average health insurance policy is going to be about $350 a month. That may not seem like, some people say $350 a month. That is incredibly affordable for a lot of people in New Jersey who are paying a lot more right now. And that's without the subsidy. With the subsidy, that can go down to $100 a month, depending upon your income. So I can't stress enough how important this is. And for the Republicans to try to hold this hostage, no one on our side of the aisle is going to give up on the Affordable Care Act because we know people need it. And we are going to move forward, and hopefully they come to their senses and don't keep trying to shut this government down. I want to commend the gentleman again. Thank you.
Mr. Pallone, thank you so very much for your comments about New Jersey. Mr. Ryan, I think we have about 2 minutes, maybe 2.5 minutes left. If you'd like to close, and then I'll take the last 30 seconds and we'll thank the public for their attention.
Yeah, no, I think the last couple of points that I'd like to make, again, we have very conservative Republican Tea Party governors saying we want to expand Medicaid, and they make all of the same arguments that we made during the health care debate. Coming into an emergency room and getting your primary care does not make any sense. You get sicker, it costs more money. There's also a moral aspect that we've got millions and millions of people going bankrupt, children not getting treatment, hitting the ceiling when they have cancer or some other issue. Those problems have been fixed. And so to those folks here in the House of Representatives need to recognize just how extreme their position is. When Karl Rove and John McCain and some of these other folks are saying, you folks are really out on a limb here, you're not making a lot of sense. That's not Tim Ryan and Mr. Garamendi and Mr. Pallone and others who they would call liberals. That's Karl Rove. Bush's brain is telling you you're way out on a limb on this one, and it doesn't make any sense. And I think that's important. You have Republican Tea Party governors making the same argument about expanding Medicaid. Critical, critical points. Lastly, as we see the top 1% and the top 1/10 of 1% garnering almost a third of the wealth created from 09 to 12, we've got a problem in this country. And so if we can't step in and say at the very least we can give some of these folks some basic health care, then we got to ask ourselves what kind of country do we really want to live in. And I yield back to my friend.
Mr. Ryan and Mr. Pallone, thank you so very much for joining us on this discussion about the Affordable Health Care Act and the way in which the Republican Party here in the House is using it as its repeal as a lever to really shut down government. It's not a good situation. We normally spend our time here on the floor talking about jobs, infrastructure, how we can move this economy and this nation forward. We hope to get back to that next week. We've got a critical vote coming in the next couple of days, or tomorrow or the next day, about really the health care of America and, more importantly, about the way in which this government should operate. Mr. Speaker, with that, we yield back our time.
The gentleman yields back.
Thanks.